I'm Peter Block here at ACC.16 for On the Scene, and with me is Erik Hess from Mayo. And Erik and I have been talking before this interview began about the issue of engaging patients in decision making, particularly in the ED. So Erik, you've done this trial. It's an interesting trial, not straightforward in terms of sort of what you were, it's sort of a touchy-feely trial, but an important one. So tell me about the trial that you did.
Sure. In our trial, we engaged patients who are being considered for admission to an observation unit for either a stress test or a coronary CT in the decision of whether to stay overnight for this testing or to follow up in the outpatient setting with their provider.
Okay, so in part of that, how did you actually do this? Did you sort of walk up to the patient and say, hey, we want to engage you? How'd you do that?
Yeah, so what we did is we designed a tool that enabled the physician in a standardized way to communicate to the patient what their objective risk was for an acute coronary syndrome in the next 45 days. And then we laid out what the management options were, and then we engaged with them what was the best fit for their specific circumstances and their individual risk for an ACS as to whether they want to stay in the emergency department for further testing or to follow up as an outpatient.
Okay, so now, I mean, this wasn't just sort of, let's see what happens. This is a real trial, wasn't it? So what were the outcomes? What were the outcome differences in the two groups? Because some of them you did not engage, I assume.
Correct. So in the arm that we randomized to the intervention, we found that the patients were more knowledgeable regarding their ACS risk. We found that they were over 2 times more engaged in the decision-making process by their clinician. And in terms of resource utilization, there was a 15% lower rate in the intervention arm among those who decided to be admitted to our observation unit for stress testing. And that we found that in either arm of the study, there weren't any major adverse cardiac events that were due to the intervention.
So I guess that's really a critical issue, isn't it, Erik, that there's no major difference in cardiovascular events. So let me ask you, sort of to wrap this up, going forward, obviously, to engage a patient is an important and something that is part of quality and is a critical thing going forward for cardiology. What do you think is going to happen? How does this trial expand to all of the EDs in the United States, for example?
Yeah, so that's a good question. We're currently planning an implementation study, so this is fit within the flow of usual care. In terms of how there's actually been multiple investigators that have contacted me and are adapting the tool to be used in their own setting. And there's a trial coming up in May that's actually going to be focusing on how it worked in a purely community setting. And so it's being adapted already.
Okay, so quality is improving if you can get the patient involved. I mean, that's a layup, isn't it? And so, in fact, this is something that's already being put out there. Thanks, Erik. I look forward to seeing how this goes forward. Very interesting part of a new sort of era in cardiology.
Great, thank you.